Good afternoon, everyone. My name is Susan Madera. I'm the Academic Specialist for High Impact Practices from the Office of Academic Affairs. I want to thank you for coming today and welcome you to this wonderful event. This event is one of many associated with the common read of the text that you see right there, The Immortal Life of Henrietta Lacks by Rebecca Skloot. I know that there is so much to be shared today, and we're going to get directly to it. And I wish you a lot of luck in your presentations. I know they're going to be wonderful. So let me do my job, and that is to introduce one of your wonderful faculty members here, and this is Professor Lorraine Capelli.
Thank you very much. Hi, good afternoon, and welcome to this Common Read event. It's going to be very exciting. You're in for a really good treat. It really very nicely tailgates into the presentation that we had this morning on health disparity. It feeds right into that. I want to introduce the other faculty that has been involved in this Common Read project with us. Professor Coalillo, Dr. Blake Campbell, and Professor Rome. Sorry, I'm not used to talking into a microphone. Anyway, the nursing faculty across the nursing curriculum have used this Common Read as a vehicle for nursing students to integrate the knowledge, the skills, and attitudes of a professional registered nurse as an advocate, a caregiver, and educator. The nursing students from different semesters will present on several of the sociocultural and health-related issues identified in the story, The Immortal Life of Henrietta Lacks. And that, unfortunately, is still apparent in today's society, as we know, as health disparities, especially among the vulnerable populations. The focus is for them to really advocate and teach the college and general community about health promotion and illness prevention as it relates to their topic, with emphasis to the vulnerable populations. We will begin with the new nursing students from the first semester as written on your agenda. There'll be 4 groups of the NU 101 nursing students, then to be followed by the third semester nursing students, particular to the topic that's on their agenda. I would like to thank and acknowledge Susan Madera for spearheading this Common Read event. It helps really impact the deep learning and increases the retention of information, and it also helps them really assimilate their role as a nurse. They'll be out when they graduate speaking to communities, possibly speaking to families, speaking to the staff on their floor, because they all become managers and supervisors, right? And I also want to acknowledge Connie Williams, our librarian, who is instrumental in compiling multiple resources for the nursing students to perform their research. So without further delay, I'd like to introduce the first group, which is Kunjal Cheswal, Jennifer Khan, Deepa Prasad, and Benjamin Yoder. Okay, thank you.
Good afternoon, everyone. Thank you for attending our presentations. My group and I will be presenting the human papillomavirus and cervical cancer. Now, I'm sure all of us are very thankful that over the time, scientists have been able to discover treatments, cures, vaccines for many of the severe illnesses such as polio, herpes, leukemia, flu, Parkinson's, and many others. Now, researchers all over the world have been able to make this possible through a specific type of a cell known as HeLa cells. Now, not very many people know where these cells actually come from or whom they've been provided by. Just this past month, we celebrated Black History Month. We honored many of the courageous individuals such as Martin Luther King Jr., Rosa Parks, Jesse Owens, and many others. But none seem to mention the one person who is responsible for many medical breakthroughs. This one person is Henrietta Lacks. Henrietta Lacks was born in the 1920s. She grew up at a time of segregation, at a time where ethical principles were not yet in practice in medicine. She had visited a doctor because she had discovered a knot in her abdominal region. For this knot, she had been seeing the doctor, and unfortunately her cells were taken from her during this time without her notification. She had been diagnosed with cervical cancer. a disease that took her life, unfortunately, but made her cells immortal. Cervical cancer is a disease that is sexually transmitted, but is most commonly linked with a virus known as the human papillomavirus, or HPV. Now, this virus was actually not even first discovered in humans at all. In the 1930s, Dr. Richard Shope had discovered the papillomavirus in a rabbit at the Rockefeller University. And it wasn't until 1976 that HPV was actually linked as a precursor to cervical cancer. Now, since the 1950s, the percent of women that have been diagnosed with cervical cancer has decreased, but the numbers are not low enough that we can eradicate this. Since 2002, cervical cancer screening in New York City has increased by 32%, but unfortunately, the mortality rate has remained steady. This is according to the Department of Health of New York City. Now, the question here is, why is this disease so severe? What exactly is HPV, and how can we prevent this? Members of my group will help and shine some light on this information and will further go into details. I'd like to introduce Benjamin to talk about this information first.
Okay, hello. The first thing I'm going to do is show a short video.
What if you quit your job to be an actor? What if you go back to school? What if you travel abroad? What if you meet someone? What if he gives you HPV and it doesn't go away? What if years later it turns into cervical cancer? What if you couldn't have kids? What if you get really sick? Cervical cancer is caused by certain types of HPV. Why risk it? Talk to your doctor to find out how you can help protect yourself.
Today, about 12,000 people ages 15 to 24 are infected with HPV. That's like one major college campus per day, every day. For most, HPV will clear on its own. But when it doesn't, certain types of HPV can cause cervical cancer. Other types can cause genital warts. There's no way to predict who will or won't clear the virus. Each day in the United States, 30 women are diagnosed with cervical cancer. That's about 11,000 women per year. And it's estimated that each minute in the United States, there's a new case of genital warts.
Okay, so for such a common problem like HPV, there are a lot of sobering facts about it that you may not have known before. Like the video mentioned, there are about 12,000 people between the ages of 15 and 24 that are diagnosed with HPV each day. So to put that into perspective, our college campus here has an enrollment of about 16,000 students total. So that's like 3/4 of our student body becoming infected each day with HPV. There are about 40 types of HPV that it can infect the genital areas of males and females alike, and it can also infect your mouth and your throat. HPV is the most common sexually transmitted virus in the United States, and more than half of all sexually active men and women will get HPV at some point during their life. So that's like half of the people in this room getting HPV. But a lot of people, currently there are about 20 million Americans that have HPV, and 6 million more get HPV every year. Many people will never actually know that they have the HPV virus because their immune systems can fight it off, and it will clear the virus, and they'll never actually know they had it. But even if you didn't know that you had it, you can still pass the HPV can still be transmitted on to other people. So you might not know you have it, but you can still be transmitting it. And also, smoking increases the likelihood that the HPV virus will change into or develop into a more serious problem like cancer. We've all heard of HIV, but HPV is different than HIV. HIV, we know, is something that is in the blood and it can cause AIDS, but HPV is also a sexually transmitted disease, but it is transmitted through through sexual contact, but it causes different things like genital warts and different types of cancer. And instead of being in the blood, it's actually on the skin surface in the genital areas. So you might be wondering how you can get HPV or how you cannot get HPV. It's passed on through genital contact, mostly during intercourse, but it doesn't have to be intercourse. It can just be genital to genital contact, or through oral sex. Many people get HPV and oropharyngeal cancer that is partially caused at least by HPV. Also, pregnant women can pass HPV on to their child during childbirth, but it's very, very rare that happens. And you might be wondering, how common is HPV and the health-related problems that it brings? Every year, there are about 360,000 new cases of genital warts in the US. So hopefully you don't know from personal experience, but those, from the pictures, they don't look too great. There are 12,000 new cases of cervical cancer in the US each year, and that results in about 4,000 deaths. There are 2,100 cases of vulvar cancers and 500 vaginal cancers, 600 penile cancers, 2,800 anal cancer in women, and 1,500 in men, and then about 8,000 oropharyngeal cancers. And the oropharyngeal cancers are linked to HPV, but they're not sure always if it's caused by smoking or HPV or a combination. So, like Kunjal stated, HPV was first linked to cervical cancer in the 1970s, but it was first found in humans in the 1950s. And so Henrietta Lacks was an African-American woman, and so I did some research on the statistics for African-American women. Nationally and in New York City, African-American women die from cervical cancer at much higher rates than white, Hispanic, and Asian women. In 2008, New York City black women died at a rate of 2.5 times that of white women. And I have a slide. So you can see here that the Hispanic population, or Hispanic women, actually are diagnosed with more new cases of cervical cancer than African American women, but the death rate is much higher in African American women than in Hispanics. And I should, I guess, mention, I'm not sure if I made that clear, cervical cancer is almost exclusively caused by the HPV virus, so I'm not sure if I made a good transition there. But regardless of race and ethnicity, New Yorkers living in the poorest neighborhoods have the highest overall rates of both newly diagnosed cases of cervical cancer and deaths. So there's no real solid research on exactly why that is, but it seems to be most linked with the lack of education and lack of access to health care. So the way to battle this, obviously, then, is to bring more awareness to especially young people, and also to make healthcare more accessible. So while there is no actual cure for HPV, there are different things you can do to prevent it, and my classmate Jennifer is going to tell us how.
It doesn't look good. Good afternoon, my name is Jennifer Can, and today I will be discussing how to prevent HPV. So abstinence, it is an absolute way to prevent HPV. However, for most adults, it may result unrealistic, absolute abstinence. So therefore, you must know that there are other ways that you can prevent HPV, and there are also factors that may lower the risk of getting HPV. The HPV vaccine is, aside from abstinence, it is an effective way of preventing HPV. The vaccine is given in 3 doses. The first dose is at the moment that you get it. The second dose would be 1 to 2 months after the first dose. And the third dose would be 6 months after the first dose. It is important that you get the whole 3 doses for a whole therapeutic effect. So you want to get the 3 doses. And even if you miss one, you want to catch up on that at least if it's within a year. If it's more than a year, then probably you are going to have to start from the beginning, the 3 doses. The vaccine targets the ages of 9 through 26, girls and boys, because HPV is not just a matter for women's right now, it is also for men's. So we are targeting the ages from 9 to 26, and the purpose of this is because we want to protect boys and girls from the exposure of HPV, so we want to protect them before they become sexually active. In the same way, HPV vaccine doesn't protect you against all the different strains of HPV, but it protects you against 4 major ones that are commonly associated with the 75% of cervical cancer and 90% of genital warts. Making use of safe sexual practices also may lower the risk of getting HPV. When we talk about safe sexual practices, most of us think about condoms, but it's important to remember that HPV, as my colleague says before, it is not an STD that can necessarily needs body fluid contact. So HPV can be getted by genital contact. Sexual activity with some people who has few or non-sex partners also may significantly reduce the risk for getting HPV. Stop smoking. As is known, smoking harms all your body cells. So if you are someone who has HPV, you have a higher risk of developing cervical cancer than a non-smoker. Circumcision is one of the factors that may influence as well. It doesn't mean that it's going to prevent HPV, but it can, if you are a male and you are circumcised, you can have lower risk of getting HPV since the pineal foreskin, it is a moisture environment for bacteria and viruses to grow. So this would reduce the risk as well. In the same way as HPV is the precursor for other type of cancers, by preventing HPV, we can prevent cancer. In women's, being proactive and towards their health and visiting regularly their gynecologist once a year, and by performing pap smears, they can lower the chances and early detection of this virus. Pap smears are one of the best ways to detect changes and abnormalities in the cervix. So it's important for you to get your check. There are reasons why some races, they might have more frequency or more tendency to perform pap smears than others. Here in the chart, we will see that non-Hispanic white, non-Hispanic black, Hispanic, and non-Hispanic Asians. Some of the reasons that, and they all have different reasons for not getting pap smears. Some of them are that they never thought about it, and others that they thought that they didn't need it, or they didn't have any problems, because HPV can be, you cannot have any symptom. You cannot, it doesn't need to present any symptom for you to have it. Some of them are thinking that it's too expensive, because that's a reality between different races, and that we are living today. In the same way, for males, they can have the throat test. They can perform rectal or anal test, which is colonoscopy, and penile test. The colonoscopy, it starts at 50, so it is better to look, we have all these different resources and we have different ways to be tested. So today, I'm gonna introduce my colleague Deepa, who's gonna be explaining the different resources that we have for HPV.
So by now, I'm sure many of you realize how important it is to get screened and vaccinated for HPV. And we know not everyone has health insurance or can afford paying for these things out of their pockets. However, there are clinics that offers HPV testing and shots absolutely free. At the end of our presentation today, we will be handing out a pamphlet with a list of support groups and local clinics that you can go to. Dealing with HPV can be stressful, depressing, and shocking. But you need to remember you're not alone. Although you might not feel comfortable discussing your problems with your family and friends, there are special support groups that you can go to both give and receive emotional support from people facing the same exact problems you are. The great thing about support groups is no one is going to judge you, and it's a great way of finding yourself again and building your confidence back up. Sometimes you might be feeling down and depressed, and you just need someone to talk to. Here at Queensboro Community College, we have a wonderful counseling center where everything is confidential and free. And for those of you who are not comfortable sitting face-to-face discussing your problems, there are online support groups such as cancercompass.com or hpvsupport.com. No matter your personality, preference, or condition, there is something for everyone. Remember, there is life after HPV. And that brings us to the end of our presentation today. In just a moment, I will be passing out a very short, simple quiz. We ask of you to complete and return it, possibly, hopefully before the next presentation starts, but if you can't, it's absolutely fine. Just pass it to the front. And above is the list of our sources that we use. It's also on the pamphlets I will be handing out if anyone would like to do any further research. Thank you.
Good afternoon, everyone. My name is Gina, and I am joined by my fellow nursing classmates to educate you on poverty and the impact on health, college students, and the challenges of maintaining health. Paula will begin by introducing Henrietta Lax.
Sorry. Good afternoon, everyone. Let me start with this. Henrietta Lax is a name you should all know. The Immortal Life of Henrietta Lax is a story about a poor woman with a middle-class education who made one of the greatest medical contributions ever. Her cells, taken from a cervical cancer biopsy, became the first immortal human cell that reproduced tremendously in labs. How would you feel if someone told you that the mother cell is still around and had helped contribute to medical research? Her cells are one of the main reasons why we have so many vaccines like the polio. It has uncovered secrets of cancer and viruses. It helped determine the number of chromosomes in our bodies, and with it, helped find out about several types of genetic diseases, and lead advances in cloning, gene mapping, and in vitro fertilization. Henrietta Lax cells, known as healer, are like little miracles being used all around the world. The author, Rebecca Skloot, takes us on an unexpected journey from where Henrietta used to live to the John Hopkins Hospital in 1950s, where her cells were taken and grown in labs without her or her family knowledge. This book is not only about science. It's about the story of human beings that had to struggle, like mostly every poor family, to survive during a time where a lot of discrimination existed and where medical researches were done on humans without their consent. It helps us understand not only the importance of health prevention and care, but also about our rights as individuals to decide about our own bodies. The lack of money shouldn't be a reason why so many of us can't receive the right health care. We are all students who are trying to progress in our education to find better jobs and at the same time be able to afford health insurance for ourselves and for our families. One of the things that caught my attention in this book was that not only poor people, but many others lacked the possibilities to obtain the right health care. Now, after many years, we are a big example of many disadvantages in our country. Some people describe poverty as a lack of necessary materials such as food, water, clothing, and shelter. Well, yes, all of them are needed for basic standard of living, but having limited access to healthcare makes a person poor too, because the relationship between these two is a complex one. Many factors such as poor diet, poor living condition, lack of education, and daily stress can cause a negative impact in our health. Poverty impacted Henrietta's health then, and now is impacting us, students. We need to promote health and prevent illness by doing such things as exercise, improving nutrition, stress reduction, and by obtaining low-cost health insurance and visiting low-cost clinics, something my classmates will encourage and give information. Next, my classmate Gina will discuss and provide data about this big problem among us.
I will start by showing a short video.
This seems like an impossible choice for a local college student. You either pay for school or you pay for your health care.
And this one is especially difficult because the student we're talking about has medical needs. As Chief Correspondent Joe Shortsleeve tells us tonight, she's not alone.
24 hours a day, it's giving me small pieces of insulin.
A diabetic since she was 9, Katie Slow of Chelmsford uses an insulin pump to regulate her blood sugar, a life-saving but expensive device.
It's almost $1,000 a month to keep her alive.
That's why her mom, a single mother of 3, was grateful to be covered under Mass Health. But something changed when Katie returned from her freshman year at UMass.
People were calling me going, you don't have insurance, are you going to pay for this?
The problem? Katie turned 19, and that's when Mass Health pulls the plug on full-time college students.
They just cut her off? Did you know that she was going to be cut off?
No.
She was uninsured with just a few days of insulin for her pump.
Without it, she dies. Literally dies.
It's scary.
The state does provide help for people like Katie. It's called the Health Safety Net, and it will provide her with insulin. It just won't cover her pump delivery system.
So it means she goes back to injections. It means her control of her diabetes is nowhere near as effective. And long-term, she could have major complications from blindness to kidney failure.
Well, it's not a problem that can be easily solved or quickly solved, unfortunately.
According to the state, Katie is not covered because as a full-time student, she's eligible for health insurance through UMass. But the nearly $3,000 price tag is not covered by Katie's financial aid. Her mom, who shares her home with another family to make ends meet, says she can't afford it. State Senator Richard Moore heads up the Committee on Health Care Financing.
So 19-year-old full-time college students on Medicaid all find themselves in this situation.
I would presume that's the case.
Katie could be eligible for more help if she were a part-time student, but that would mean the end of her college financial aid package.
It's not a good choice to have to choose between full-time college and health coverage. And so we need to really take a look at this.
Katie says she doesn't want to depend on the state, and for that, she needs to go to college.
Get through my major, graduate, and get a job that I can, sustain myself on.
Under national health care reform, students from families with private insurance are covered until age 26 on their parents' policies. But Katie and countless other students are on their own. Joe Shortsleeve, WBZ News.
Okay, so by a show of hands in here, how many people are uninsured? Okay, and how many people in here are limited to their coverage? Some just have medical, they don't have dental or optical. Anybody? Okay, and well, for me, I graduated from CW Post 3 years ago with an education degree, and I could not find a job, and I lost my health insurance. And when I first graduated, I thought, well, when I was in college, I thought once I graduate, I'll be able to find a job and I'll get health insurance and my life is going to be all perfect. But as we get older, we realize that's not the case. Health insurance is extremely expensive, and with all your daily, expenses, how can anyone afford it? In the video, you see a 19-year-old girl who is struggling with a decision on her health and her college career. Many people like Katie Slow are facing challenges. Diabetes is the 7th or 8th leading cause of death in the age group between 18 and 25. I can't imagine having to choose between health care and my college career. Back in the 1950s, mainly the people affected were the uneducated, the poor, or the minorities. Today, 20% of all college students are uninsured. And in 2011, 53% of young college graduates in America were either unemployed or underemployed. The average annual premiums for health insurance for single coverage is nearly $6,000. And the average cost in student loans are $27,000. But if you're unemployed or underemployed, like the 53% of college graduates, how can someone afford paying that on top of the daily requirements? Some facts that are important. Facts that are important to know about healthcare are that in 2014, most people will be required to have health insurance, or they will have to pay a penalty. People between ages 19 and 29 are one of the largest populations in the U.S. without health insurance. People between 19 and 29 are less likely than those between 30 and 64 to work for companies that offer health benefits. 15% of young adults suffer from 1 in 6 health conditions. Some examples are arthritis, asthma, heart disease, and like Katie Slow, diabetes. 1 in 4 of all HIV and AIDS diagnoses were among the adults between 20 and 29, and more than 1/3 of women between ages 20 and 29 are infected with HPV, which causes cervical cancer. And finally, 28% of young adults are overweight and 24% are obese. In the last 30 years, this age group has increased in obesity threefold. And as we all know, obesity can lead to many different health diseases, including diabetes. As you can see, our age group suffers tremendously from many different diseases. Without health insurance, it may be a little harder to maintain and receive appropriate health care. However, there are many ways to prevent illnesses. My classmate Searing will explain the importance of nutrition and explain why the sayings, an apple a day keeps the doctor away, and you are what you eat, are true.
Hi everyone. Today I'm going to talk about nutrition. And according to WHO, nutrition is the intake of food considered in relation to the body's dietary needs. Good nutrition, physical activities, and healthy body weights are essential part of person's overall health and well-being. Together, this can decrease person's risks of developing serious health conditions such as high blood pressure, high cholesterol, diabetes, heart disease, stroke, and cancer. Most Americans, however, do not eat healthful diet and are not physically active at levels needed to maintain proper health. Fewer than 1 in 3 adults and even lower proportion of adolescents eat the recommended amount of vegetables each day. Majority of adults, 81.6%, and adolescents, 81.8%, do not get the recommended amount of physical activities. Therefore, to encourage health-conscious eating habits, I want to share my daily food plan with calorie calculating method, tips to improve healthy eating habit, and list of healthy foods from our own QCC cafeteria. Okay. First of all, I have the daily food plan, which tells us what and how much to eat within our calorie allowance. In order to calculate the calorie allowance, I'm using the Harris-Benedict formula. And I have it on my handout. It's on the second page. I'll give you at the end. After that, after calculating your calories per day, you can go to the website choosemyplate.com.gov, which has the daily food plan, and I also have that sample on my handout, and it has the website name too. You might not be able to follow everything that is on the daily food plan, but if you try, which can definitely help you minimize the risks of health problems. I have some more tips to improve healthy eating habits. Eat less. Take your time to eat food. That will make you feel like you have ate enough. Eat more vegetable, fruits, whole grains, fat-free, or 1% milk and dairy products. These foods have the nutrients you need for health, including potassium, calcium, vitamin D, and fiber. Make them the basis for meals and snacks, but fewer calories and less saturated fats. Choose red, orange, dark greens, vegetables like tomatoes, sweet potatoes, and broccoli, along with other vegetables for your meal. Eat whole wheat bread instead of white bread, brown rice instead of white rice. Cut back on foods high in solid fats. added sugars and salt. Choose food that has a label, low sodium, reduced sodium or no salt added. Cut calories by drinking water or unsweetened beverages. And last but not least, I encourage everybody to bring your home-cooked food. If you want to heat it, we have a microwave at the Student Union building. And that's all. Thank you. Next, we have Diana. She will be talking about physical activities, importance of physical activity.
Okay, hello everybody. My name is Diana Fajardo and I'm going to talk about physical activity and health. Well, due to difficulty in getting insurance, we can find a way that can help us from getting any disease and maintain our body in the pink of health. The best way we can choose is exercising. Exercise promotes health and prevents illness. Experts recommend to exercise 20 to 30 minutes 3 times a week or more. And a regular exercise can improve your mood and help you to better manage the stress. You know, college life is very stressful. Some people are in a constant state of trying to catch up, and not getting insurance is very frustrating. So actually, stress and depression are the most prevalent mental health problems that students confront. And so, and suicide, which is the leading cause of death among college students between ages of 18 and 24, which is due to when a person feels very depressed. So a way to prevent this is doing exercise. When we do exercise, our brain releases a chemical that gives us a sense of well-being, good mood, and increased self-esteem as well. Okay, and diabetes and obesity, which is also very common, as the video showed. Not having insurance is really hard to continue with the required treatment because of the high cost of the equipment or medicine. Actually, obesity leads to diabetes, and when we're doing exercise, reduces body fat and can help us to control our weight and thus prevent diabetes. Also, exercise makes your bones and muscles strong, helping us for having good circulation and prevent heart disease or stroke. So, and if we don't suffer any disease and we exercise regularly, so we can have more chances for living longer. Actually, Queensboro has facilities we can take advantage of, like outdoor track. If you want to walk like between hours, if you have a chance, like 5 to 10 minutes, and we have also gym, the pool. The hours in the field and the hours of the gym and the pool, you can find in the handle we're giving at the end. Also, you can find facilities outside the campus, like indoor pool, running tracks. You can go to this website, New York City Golf Parks, and you can find there more information. So some of them are free. As we can see, a combination of exercise and good nutrition contribute to promoting health and prevent illness, right? So, and now my next peer, Maureen, is going to talk about free and low-cost clinics and public health insurance.
Good afternoon. My name is Maureen Appel, and I will be talking about many services and clinics that provide low-cost and free health service in the New York City area, because we still need checkups, vaccinations, tests, pap smears, treatments, and so on for the uninsured to promote health. There are also low-cost insurance plans for students and families who can qualify. Okay, so for dental, There are many clinics all over New York City, such as Brooklyn, Manhattan, Queens, and Bronx, that provide low-cost treatment, which is very accessible. Also, the New York City Health and Hospital Corporation Clinic is a large public corporation in New York City consisting of hospitals, treatment centers, care facilities, agencies, and clinics. Their mission is to provide services for everyone who needs care regardless of their ability to pay. Again, located all over New York City. The Department of Health and Mental Hygiene offers individuals and families free health services, including immunizations, STD testings, tuberculosis services, flu shots, and with no income requirements. So this is obviously all over New York City again, which is very easy to promote your health and well-being. Health insurance is really important because it pays for medical care preventing and treating illnesses while also paying for many health care services. So, if you have a child, Child Health Plus provides free or low-cost health insurance for children under 19. This is an example of the monthly income eligibility rate by family size. The eligibility for insurances such as Child Health Plus and Medicaid for children includes age under 19, you must be a New York State resident, and you cannot have other insurance coverage. For us college students, Medicaid and Family Health Plus are public health insurances, Medicaid primarily being for low-income adults, and Family Health Plus for having income too high to qualify for Medicaid. For Medicaid, you have to be, and for Family Health Plus, you have to be eligible the same 19 to 64, a New York State resident, and you cannot have another health insurance coverage. Again, you can see the income eligibility, children under 1, so that would be for coverage for children, and then Medicaid for us adults, 19 through 10 and 21 through 64. Same requirements for Family Health Plus, and as you can see again, the eligibility income. The benefits covered for all of these known public health insurances include immunizations, hospital care, ER room care, prescription drugs, dental care, eyeglasses, specialty care, medical equipment, smoking cessation, which is very convenient for our well-being. You can enroll for any of these by calling 311 and asking for HRA Medicaid helpline to find out if you're eligible for any of these mentioned insurances. These are a list of our references that you can just sign on, whatever, and it'll give you a lot of more detailed, along with the pamphlets and flyers I received from the gentleman outside that's in charge of the table for health insurance. He's available on Wednesdays from 9 to 1. And this concludes our presentation on poverty in college students and to maintain their health. If you have any questions, Gina and Paula will answer at the very end. Thank you.
Good afternoon, ladies and gentlemen, and I'm Dr. Billy Campbell. I'm here to introduce the next set of students. The first group will present on patients' rights. Because historically patients are often in awe of doctors and other healthcare providers, they literally surrender their rights to choose wisely when it comes to healthcare. In the case of Henrietta Lacks, just to have access to Johns Hopkins Medical Facility was a privilege. The second group will focus on the need for our healthcare clients to receive culturally competent care. As the ethnic profile diversifies in the United States, so must the healthcare workforce. I believe Queensborough is helping to meet those needs. health disparities and stories similar to Henrietta Lacks has caused a federal mandate to come about called the class standards to ensure that healthcare professionals who receive Medicare and Medicaid reimbursement train their staff to deliver culturally competent care. So without any further delay, I will introduce the first group.
Hello and good afternoon, everyone. Thank you for coming. My group will start a presentation with a skit we put together with exact quotes from the book, and then a poem will follow right after. I hope everyone enjoys it. I'm Carol, and I'll be playing Babette, Henrietta's daughter-in-law.
I'm Isabella, and I'll be playing Deborah, Henrietta's daughter.
Hi, my name is Grace. I'll be playing Zachariah, Henrietta's son.
Hi, my name is Lily, and I'll be playing Dr. Guy, the doctor who took Henrietta's cells.
Nobody ever asked me about. Nobody ever said nothing about my mother, Henrietta Lacks. I mean, where my mother's clothes at? Where my mother's shoes? Everything is always about her cells and never about. Oh my God. Everything is always about themselves and never worry about her name or if Hila was even a real person. Her cells have been so important for science, the least they can do is give her some credit.
Yes, it's quite possible that these cells can teach us how cancer cells can be damaged or completely wiped out. I will share the healer cell line with anyone who needs them.
What? You can't share those cells because you took them and you didn't ask. Henrietta Lacks didn't donate anything. You never told the family anything. You knew how to contact us.
I just want to know what's been going on after all these years. Not knowing who to go to for understanding. No one from the medical field took the time.
Yeah, what Dr. George Gray, or whatever his name was, did was wrong. Dead wrong. You don't lie to people and clone people behind their backs. That's like me walking in your bathroom when you in there with your pants down. It's the highest degree of disrespect. If you were still alive, I would take a black pitchfork and stick it where it hurts.
Zachariah.
Me and my mother, nobody got benefit from those cells. If you and me needed something from the doctors, we couldn't afford to go see one.
But I didn't make any money out of healer cell. If I were in her situation, I would have done the exact same thing for other thousands, millions of cancer patients.
I don't even care about the money that much. I just want somebody that I can trust. Someone who will talk to me and tell me what's going on. I just miss you, Mama. Hila. The name on the vial. Endless glass. How can you be here and yet not with me? How can you be dead and yet immortal? I am trapped just like you. Endless glass. Scientists gaze at me and my family like we are not human anymore. Just like you aren't human anymore. I'm pressing against the glass, screaming for answers that never come. And all I can picture is your body, your pain, your tumor pearls. I look at the vial in my hands. Does it hold the secrets to your life, to your heart, to the mother I never knew,
Hands are grabbing me, reaching inside. Suddenly it's my name on the vial. Dila, Immortal together.
Good afternoon. I'm your friend Lilia Bebio, and I'm a student of Queensborough Community College. I'm here to talk about clients who are not aware of their rights, but were suspicious enough not to sign consent. Our goal here is to discuss health disparities in the healthcare system and the medical injustice that have occurred and will occur if these issues are not addressed. Healthcare provided should not depend on a person's race, ethnicity, socioeconomic status, gender, disabilities, level of education, and age. Everyone is entitled to receive quality healthcare. As nurses, we must develop intervention to help eliminate these health disparities and reduce health disparities in our societies. The story of Henrietta Lacks would remind us of injustice that were perpetrated by the healthcare industry and on the poor and uneducated some years ago. Henrietta Lacks was an African-American woman who was diagnosed with cervical cancer in 1951. She had samples of her damaged cells taken from her body without her knowledge and permission. Her cells would grow and multiply and be used all around the world. 20 years later, her family will find out that her cells are alive and would question why they never knew and who gave consent for Henrietta Lacks cells to be taken, since neither of them did. In this modern day, there are people just like Henrietta Lacks, people who have rights but are taken advantage of. Minorities, illiterate, non-English speaking natives are more likely to be mistreated and have their rights violated due to lack of knowledge. They conclude that the doctor knows best and never question his actions. They are unaware of their patient rights and do not understand procedures performed on them. The common rule is a federal policy for protection of human rights used in research. It was issued in 1991 by 15 federal departments and agencies. The common rule requires that all people who participate in research have given their fully informed, fully voluntary written consent during the time they participate and are told any foreseeable risks or benefits. The common rule applies to everyone, irrespective of age, race, and socioeconomic status. The need for an informed consent allows the patient to be involved in his or her healthcare decisions. Henrietta Lacks never gave an informed consent for her cells to be taken. Nowadays, foreskins of circumcised infant boys are sold often without the consent of their families to cosmetics and bioengineering companies. One foreskin can sell up to $100,000. They are never told about the benefits associated with it. Their patient rights, just like Henrietta Lacks, are ignored and violated. Our duty as nurses is to ensure the patient has full understanding of procedures and understand they have the right to consent or refuse treatment. We must follow the ethical principle of autonomy, which requires us to give the patient rights to make their own healthcare decisions, because the change begins with us. Next, my colleague Carol is going to talk about clients who do not know their patient right but consented.
Hola y buenas tardes. Mi nombre es Carol Solorzano y soy una estudiante de Queensborough Community College. I will be talking about patients who do not fully understand their rights but coerced into giving consent. A big problem with healthcare then and now is the fact that many patients do not fully understand their rights but give consent. As nurses, our goal is to make sure patients have full understanding of their rights so they are able to make good decisions about their health care. A patient in New York has the right to understand their rights, receive treatment without discrimination, receive complete information about their diagnosis, treatment, and prognosis, receive all information needed so they can give full consent, refuse treatment, and be told what effects these treatments may have on their health, and that's only naming a few. Many times, these rights are compromised by language barriers or health literacy, which affects the poor, the elderly, and immigrants. As defined by the Institute of Medicine report, health literacy is the degree to which an individual has the capacity to obtain, process, and understand basic health decisions. Basically, this is the ability to understand health information and use it to make good decisions about your health care. A study done in 2006 by the U.S. Department of Education found that 36% of adults in the United States have only basic or below basic skills for dealing with health material. This means that 90 million Americans can understand discharge information at a 5th grade level. Though we can't change this statistic, we should make it a goal to diminish the effects of health literacy, whether that is by using a teach-back method, providing information in the patient's primary language, or using simpler language. When we first hear about Henrietta's cervical cancer, she is describing a knot in her womb to her cousins. Having had only a 6th or 7th grade education, she had never heard words such as biopsy or cervix before. All she knew was that something was wrong with her. Once diagnosed, Henrietta signed an operation permit and started her cancer treatment the next day. Dr. Lawrence Worthen Jr. started the radium treatment. No one bothered to tell Henrietta the negative effects of the radium. Surely she wouldn't understand much, but she would understand that people were dying and that she would become infertile. That alone would have changed her decision. Henrietta was not able to make good decisions about her health care due to being a person of color who was not given enough education and believed that a doctor knew best, something that is still seen now. Such was the case of the Tuskegee experiment, which lasted 40 years between 1932 and 1972. The U.S. Public Health Service conducted an experiment on 399 black men who were in the late stages of syphilis. The men were for the most part illiterate sharecroppers and came from one of the poorest counties in Alabama. They were never told what disease they were suffering from or how serious the disease was. They were lied to and taken advantage of because of their poor economic being and lack of knowledge all the way up until their deaths. The experiment went on even when penicillin was discovered, and these men were denied it. If any of these men had known about their rights and had someone help them understand their situations and any medical advances being made, the outcomes might have been different. As future nurses, we do not want to have situations such as Henrietta's or the men of the Tuskegee experiment. Our goal should be to help them understand every single detail, no matter how minuscule it may seem. We must assure that patients know exactly what they're giving consent to and give them all the information needed so that they can make their own judgment on how they want their health care to go. My colleague Isabella will now speak.
Isabella QCC Wusi Hoksan. I am here to discuss an ethical issue that doctors and nurses face day to day. Competent patients who fully understand their rights but refuse treatment and/or medications. Patients who are competent are those who are able to understand and make their own decisions. They are generally mentally healthy and can have thorough conversations. Whether the treatment or medication is life-sustaining to the coherent patient, they still have the right to refuse it. It is our job as future nurses to promote health and help patients understand the reasons and processes of their treatment. We also advocate for them and explain the rights the patients are entitled to. Patients' rights to refuse is fundamental and reflects healthcare providers' respect for autonomy of the individual. As nurses, there can be times when we feel obligated to help the patient make the right choices, especially when the treatment is life-sustaining. But we must understand that it is unlawful to force a refusing patient to treatments or medications. If they refuse, we must respect their decisions as coherent individuals. An example of a patient who refused treatment that could have saved his life was a teenage Jehovah's Witness. 15-year-old Joshua McAuley was pinned against a wall by a car accident in May 2010. He suffered serious abdominal and leg injuries, but because of his religion, had to refuse the blood transfusion. He was pronounced dead after his refusal of the blood transfusion. But because he was a minor, doctors could have went to obtain approval from the parents, but they also practiced the religion of Jehovah's Witness and did not allow the blood transfusion for their son. One situation when parents' right to refuse could be overruled occurred with a dying homeless man with chronic gangrene, osteomyelitis, and diabetes. He refused interventions of any kind and did not allow doctors to treat or submit him to the psychiatric evaluation. He said he just wanted to be fed, given insulin, and given a bed. The doctor had to determine if the patient could make his own decisions. If not, a surrogate must be found. We must remember it is unacceptable to discharge a very sick man to die in the streets. Because the sick homeless man was throwing urine at the nurses, the doctor got a court order for the patient to speak with a social worker. New York law states that a court order can be obtained to treat mental illness if the patient is certified by 2 physicians to be a danger to themselves or to others, against their will in the psychiatric unit. If he still refuses, the doctor must get another court order to appoint a surrogate to oversee his continued care. The psychiatrist had a conversation with the man that made clear he was not capable of making decisions. During the conversation, the man allowed the doctors to call his mother. She confirmed his mental illness and encouraged the hospital to force him into care. The hospital saw it and was granted permission to treat the man against his will. Last but not least, an example when doctors had lied to the patient to avoid patient's refusal was mentioned in the nonfiction story of Henrietta Lacks. His name was John Moore, and he was, like Henrietta Lacks, a victim who was not informed on the extracting of body samples used for research. John Moore had developed hairy cell leukemia and had his 22-pound spleen removed in order to live. His local doctor referred him to David Gold, a cancer researcher at UCLA. Moore signed a consent form stating the hospital could dispose of any severed tissue or member by cremation, and agreed for follow-up exams that required airplane travel from Seattle to Los Angeles. Once Moore had questioned Gold why he couldn't just have a local doctor take his bone marrow, blood, and semen, Gold offered to pay for his flight tickets. Moore got more suspicious when he received another consent form stating, I do not voluntarily grant the University of California and all rights I or my heirs have in any cell line or any other potential product which might be developed from the blood and or bone marrow obtained from me. Moore asked Gold if his samples were being commercially sold, and Gold said no. So, just in case, Moore circled I do not on the form and went to seek a lawyer after Gold had called and mailed him more consent forms, pushing Moore to circle I do. It turned out that throughout those 7 years after his surgery, David Gold was developing and marketing a cell line called Mo. He had entered into agreements with biotech companies that gave him stocks and financings worth more than $3.5 million to commercially develop and scientifically investigate the Mo cell line. To conclude, as future nurses, we must remember no matter what the situations are, that we advocate for all patients. Our job is to promote health and to make sure that the patient can understand their rights in whatever language and in whatever way they can to make their own decisions about their care. We must educate them and respect their autonomy as individuals. It is unlawful to ignore a coherent patient's right to refuse. Whatever the reason, the best we can do is educate them and provide emotional support. And with that said, I'm going to let Grace come finish up our presentation.
안녕하세요. 저는 QCC의 간호대생 Grace입니다. I'd like to discuss rights that all patients are entitled to. After the horrors of Tuskegee experiments and the Nuremberg trials in 1950s, the US government issued the Belmont Report in 1979. This was to set basic boundaries to protect everyone from suffering the same injustice as Henrietta Lacks. Dr. George Guy discovered in 1970 that he had pancreatic cancer. He spent his entire life fighting this disease, and he knew exactly what options were available to him as a patient and a research subject. He offered himself to many researchers, understanding what were possible side effects of such experimental treatments, and his informed consent was meaningful because he fully understood his rights as a patient and a research subject. Dr. Guy is an excellent example of a patient that the Belmont Report and we, as future nurses, strive to have. The Belmont Report consists of 3 parts: principle of respect, beneficence, and justice. The principle of respect states that a person must enter into research voluntarily and with adequate information. Principle of beneficence insists that researchers must maximize possible benefits and minimize harms. Principle of justice addresses the beneficiary and the bearer of burden of the research. It says that many times, subjects are chosen from economically disadvantaged groups, while benefits are enjoyed by groups that can afford treatments. And it could be found exploiting these disadvantaged people. This principle attempts to ensure that Henrietta's descendants, like Zechariah, are able to enjoy medications that were found using these kind of cells. Research subjects must never be selected because of easy availability, compromised position, or manipulability. Immigrants, less educated people, and socioeconomically disadvantaged groups are especially exposed to this harm, since they're intimidated by authoritative figures. They tend to agree with everything because they're afraid to ask for an interpreter or just an easy explanation. Our group introduced ourselves in our native language at the beginning of this presentation to demonstrate the frustration of inability to understand. We must advocate for such patients. People generally feel more comfortable with nurses, especially ones that could speak their language and or are willing to take their time to educate them on options available to them. Cultural sensitivity is not a responsibility that is limited to a minority group like us 4, but everybody in the medical field. Irma, who is a more recent example, is a college-educated white woman in middle class. She had a breast cancer and she was sick for 8 years, but she never gave up. She was informed of her rights to pain reduction, living will, refusal of treatments, and death in peace and dignity. However, even as her blood count got very low, one lung collapsed, and she felt excruciating pain, she chose to fight her disease. Her choice was respected and supported by her medical faculty. We must educate our future clients and advocate on their behalf so that we only have fully informed patients like Dr. Guy and Irma. According to the latest statistic by U.S. Department of Education dated 2003, only 12% of the population is at this level of understanding. This is estimated to cost between $50 to $75 billion per year. We must reduce this figure so that we never have another patient like Henrietta, who was neither given information about research done to her cells, nor was she even given a choice to consent. If there's a cultural barrier, language barrier, socioeconomic barrier, we must bridge that gap. If clients do not wish to continue their treatment or participate in the research, they must know that they can say no anytime they want. We will never have unacknowledged or involuntary hero or heroine like Henrietta Lacks again. Thank you, and we hope you enjoyed our portion of the presentation.
Good afternoon, ladies and gentlemen. Thank you for being here. My name is Tiffany Ivy, and myself, along with my group members, Saeed, Ben, and Jenny, are going to be discussing culturally competent care. The World Health Organization's Constitution states that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic, or social condition. Henrietta Lacks lived during the era of segregation, when few hospitals accepted Black patients. She was fortunate to have been treated at Johns Hopkins Hospital and to receive the standard cervical cancer interventions for the times. Unfortunately, because most of the Blacks that did receive health care couldn't afford to pay for it, they were often used as guinea pigs for research as a form of payment. John Hopkins, whose family freed their slaves before the Civil War, wrote in his letter to his trustees that the hospital shall admit the indigent poor without regard to sex, age, or color. When the hospital first opened in 1889, the second patient admitted was Black. At the end of the first full year of operation, 13.6% of patients were listed as colored. By 1900, it was 20.7%. The medical staff at Hopkins was expected to provide all patients with the same courtesy and standard of care. So even though Henrietta at the time didn't have many options, she was fortunate enough to go to one of the best hospitals and to receive the best care that she could at that time. She received the same care that a white woman would have received for her same diagnosis, which is cervical cancer. Before the civil rights movement of the 1960s, Blacks made up less than 3% of American physicians, although they represented 10% of the population. At that time, most medical schools admitted, on average, one minority student every other year. Minority enrollment in medical school rose to 8% in 1970, but stalled until 1985. In 1990, enrollment increased to 1,500, falling in line with the Association of American Medical Colleges Project 3000 by 2000. The goal of Project 3000 was to have at least 3,000 new med school applicants by the year 2000 in an effort to help close the diversity gap in healthcare. So the federal government did recognize that this was a problem, and this was one of the initiatives that they started to try to combat that. As of the 2010 census, minorities made up 36.3% of the U.S. population, with Hispanics being the largest of those ethnic groups at 16.3%. It is projected that by 2042, minorities will make up over 50% of the population. Currently, minorities only account for 9% of physicians, 7% of dentists, 10% of pharmacists, and 9% of registered nurses. Compared to the nation, minorities make up 41.7% of New York's total population. According to the 2011 census data for Greater New York, 39% of healthcare and social assistant employees were white, 14.9% were Latino, 29% were Black, and 10.61% were Asian. So compared to the nation, New York does have a higher percentage of minorities and a higher percentage of minorities that work in healthcare. But because our population is so diverse and we're so concentrated, it still doesn't make up the gap in healthcare. We still have to do more. While progress has been made, there is still much that needs to be done to increase diversity in healthcare. Diversity is necessary because the workforce needs to represent the population it serves. In order to receive the best care possible, patients must feel completely comfortable with their providers. Part of that comfort comes from knowing that they will receive culturally competent care. Culture refers to one's beliefs, values, traditions, language, religion, and ethnic identity. All of these factors influence a person's concept of what health is and the decisions they make in regards to their care. When a healthcare provider is aware of and accustomed to a patient's culture, it allows them to approach treatment in a culturally sensitive way that won't intimidate the patient. When medical advice falls in line with personal views, patients are more likely to comply with their provider's recommendations. This results in more effective care and greater patient satisfaction. It has been shown that minority healthcare providers generally serve minority patients, and that minority patients generally choose minority providers. So there seems to be some type of invested interest in one's own community. Usually when you come from a community that's underserved and you've you've grown up with the problems, you try to fix that. So the people that do end up becoming healthcare providers, usually they serve their own community and try to help out in that way. So this is a case study that we have of a 17-year-old Vietnamese male who is HIV positive and has been taking herbal remedies. So his name is Vu Nguyen, and he's being treated for HIV. The patient and his family showed distrust for healthcare practices and practitioners to the point that they chose to use traditional Vietnamese herbal medicines instead of the antiretroviral prescription the clinic had prescribed. How can healthcare practitioners impact the care of Vu Nguyen, especially as he has chosen traditional therapy? So here I have a cultural insight which just states that Asian and Pacific Islander cultures, among others, use traditional therapies, including acupuncture, to treat illness. So as nurses, we're on the front lines, and one of our main responsibilities is to advocate for the patient. So in regards to providing culturally competent care, there are certain things that you should discuss with the patient, because cultures differ in the way that they view health and illness. So one of the things you could ask them is, what do they think is wrong? This is how you try to find out what they call their problem. And it's getting to the patient's perception of what the problem is. So the same symptoms may have very different meanings in different cultures and may result in barriers to compliance. For example, among the Hmong people, epilepsy is referred to as the spirit catches you and you fall down. Seeing epilepsy as spirit possession, which has some positive connotations for the possessed, is very different from seeing it as a disruption of the electrical signals in the brain. This should lead to a very different doctor-patient or nurse-patient conversation and might help explain why such a patient may be less anxious than the physician to stop the seizures. Understanding the patient's point of view can help the healthcare provider deal with potential barriers to compliance. Another thing you should try to find out is what do they think caused the problem. So this gets at the patient's beliefs regarding the source of the problem. Not everyone believes that disease is caused by germs. In some cultures, it is thought to be caused by upset in body balance, breach of taboo, similar to what is seen in the US as diseases due to sin and punishment by God, or spirit possession. Treatment must be appropriate to the cause, or people will not perceive themselves as cured. Doctors thus need to find out what the patient believes caused the problem and treat that as well. For example, it may sometimes be appropriate to bring in clergy to pray with them if they believe God is punishing them for some transgression. Another thing you want to determine is how the patient copes with their condition. You can ask them what have they tried to done to make it better, or who else have they seen for treatment. This will provide the healthcare provider with important information on the use of alternative healers and treatments. Most people will try home remedies before coming into the physician. However, few will share such information due to fear of ridicule or chastisement. It's important that healthcare providers learn to ask in a non-judgmental way, since the occasional traditional remedy may be dangerous or could lead to a drug interaction with prescribed medications. This question can also help you discover if they've been unable to cope with whatever is going on. And also, you should try to find out what the patient's concerns are in regards to the treatment that you suggest once you've come up with a diagnosis and you try to figure out an intervention. You want to understand the patient's perception of the course of the illness and the fears that they may have about it so that you can address their concerns and correct any misconceptions. You also want to know what aspects of the condition pose a problem for the patient. This can help you uncover something very different from what you might have expected. It is also important to know their concerns about any treatment you may prescribe. This can help avoid problems of non-adherence, since some patients may have misplaced concerns based upon past experience. For example, some patients may not be taking insulin because they believe insulin causes blindness. They've seen friends and family members go blind after going on insulin, and they incorrectly perceive that as a cause. It's a logical assumption based on observed cause and effect. Unless a healthcare provider asks, however, the patient may not elicit such beliefs and will simply not take their insulin. By asking, the healthcare provider can correct any misconceptions that can interfere with treatment. So now I'm going to have Saeed come and talk about whether or not going to providers of your peers is a good thing, necessarily, all the time.
Hi, good evening. Good afternoon, everybody. The fact that most people prefer healthcare providers with backgrounds similar to their own raises some important questions. Is it really a positive or negative thing? Or is it always possible to go to your peers? Imagine this situation. Let's say Mr. Peterson and an 80-year-old white male just moved to a rural area where there are only 2 physicians. One of them is black and the other one is white. The black doctor graduated from Harvard Medical School at the top of his class and has been practicing successfully for 15 years, while the white doctor recently graduated from Hofstra University Medical School and achieved average grades. In the past, Mr. Peterson has always gone to white doctors because he feels that they're more trustworthy than their counterparts. However, in this case, Mr. Peterson may not get the best care available to him if he chooses the white doctor. Being from Bangladesh, I myself prefer to have a doctor from my own country. But at what point do you sacrifice quality of care for comfort and vice versa? In regards to Henrietta Lacks, she waited for over a year to go to the doctors and find out what was wrong with her. Could the fact that she had no choice but to go to a white male doctor have contributed to her waiting so long? Would she have gone to the doctor sooner if she had the option of seeing a black doctor, but she felt more comfortable with? We will never know the answer to these questions, but many people still face these problems today because there aren't enough healthcare professionals of all ethnic backgrounds. So here in the graph, from 2004, we can see that the number of white registered nurses are way more higher than other ethnic groups for 100,000 population of each group. So what must be done to solve this problem? As the nation's population continues to grow and diversify, the healthcare system has to change and adjust to the needs of an increasingly multicultural patient base. All patients, regardless of race, ethnic origin, gender, nationality, primary language, socioeconomic status, sexual orientation, culture background, age, disability, or religion, deserve high-quality health care. As our society increasingly becomes racially and ethnically diverse, physicians and other healthcare professionals need to acknowledge the culture, informational, and linguistic needs of their patients. Health literacy among racial and ethnic minorities must be strengthened in a culturally and linguistically sensitive manner. Now I'm going to invite my next group member, Bin. Thank you.
The federal government has been advancing the cultural competence agenda in various ways. For instance, Natural Resource and Service Administration, in partnership with the Institute for Healthcare Improvement, has developed health disparity collaboratives focused on addressing racial ethnic disparity at community health centers. Through the use of quality improvement models, several strategies are being implemented to improve healthcare delivery to diverse population, including developing cultural competence systems of care and the techniques for more effective cross-cultural communities. Also, the National Institutes of Health and the Agency of Healthcare Research and Quality have funded research and education in cultural competence over the past few years. In 2004, several bills were developed in the House and the Senate targeting the elimination of racial and ethnic disparities in healthcare. Within this proposed legislation have been activities related to cultural competence education. Although none of these were brought forward for vote, they may still move forward in the upcoming years. Most importantly, it appears that cultural competence have caught the attention of the federal policymaker as part of an effort to eliminate racial ethnic disparities. I want to talk my personal experience. I'm a Chinese. I have been here for 2.5 years. I have a Chinese doctor. The reason I choose a Chinese doctor is because I feel more comfortable with her. It may be that we have the same values and beliefs. My English is not so good, so I can communicate with her more easily. I'm more willing to listen to her plan of care. Okay, my colleague will show this video to you guys.
Okay, so we have an ad here from Empire Blue Cross, and it's a short video, and I just think that it really talks about what we've been discussing so far. And then after this, my group member, Jenny, will speak about one of her personal experiences.
Diversity, New York, one and the same. Millions live, eat, shop, and commute shoulder to shoulder. That's why it's known as America's melting pot. How awesome a concept that is. Empire Blue Cross Blue Shield is New York's largest insurer, covering nearly 6 million people. The people we serve represent thousands of ethnicities, cultures, and religions. So, we created a community ambassadors team. This team builds relationships with leaders and activists in diverse communities. Because if we don't understand our clients, people won't choose to do business with us. Nor will we attract and keep talented employees. We're lucky to be a part of this beautiful population mosaic. We understand the value of embracing the diversity of our people, our cultures, and our communities.
Before I read the story, I just want to ask, what is diversity? There are many definitions on what diversity is, such as the ones my classmates stated, but Queensborough website defines diversity as the concept of diversity encompasses acceptance and respect. It means understanding that each individual is unique and recognizing our individual differences. This can be along the dimensions of race, ethnicity, gender, sexual orientation, socioeconomic status, age, physical abilities, religious belief, political beliefs, and other ideologies. It is the exploration of these differences in a safe, positive, and nurturing environment. It is about understanding each other and moving beyond simple tolerance, to embracing, celebrating the rich dimensions of diversity contained within each individual. To conclude, the question always has been and always will be, how do we live and work together despite our great differences? The answer to this question is, whatever it may be, it must include mutual understanding, compassion, and respect to the important matter of what it means to be human. Instead of me talking about my cultural background, such as practice ceremonies or beliefs, I decided to incorporate it in a story. And it goes like this. Titled, A Native Haitian Story. It is 7 a.m. in the morning. It is 7 a.m. in the morning in Uptown, Queens, and you're waking up with abdominal pains. The couple of days, your symptoms include an on and off fever, body aches, vomiting, and lack of energy. As you lay in bed, your mother is awakened by the sounds of your pain. She enters the room with concern to check and ask if you're okay. You replied, no. Without any hesitation, your mother says convincingly, her exact words, there is nothing a little back-home remedy can't cure. You're reluctant to call the doctor, a male in his late 40s, whom you assume is Irish, based on a poster you saw in his office, which read, the Irish nation cherishes its special affinity with people of Irish ancestry, living abroad who share its cultural identity and heritage. You immediately start to have flashbacks about your last visit when you told him that all your past illnesses, conditions such as headaches, body aches, and the common cold were treated and cured by home remedies. You went even further and told him that your money spray bottle purchased from one of the botanical stores around the corner from your house helped you with some of your previous finance problems. The afterlook upon his face still haunts your memory even till this day. Your mother returns from the kitchen with a lit candlestick, a rosary, Bible, some essence water, and a tiny bottle labeled healing oil. At this point, the pain progressively worsens. A sense of fear enters your mind, followed by the horrible thought of being bedridden in a hospital with that Irish doctor hovering over you, still shaking his head in disbelief. With the candlestick half melted, numerous of chanting continues, which now resembles sounds of a broken scratched record, and what was left of the healing oil is now done. Now in a daze and still in pain, you can't help but think, what are my options now? You think about calling your aunt's doctor that she told you is Haitian, but quickly remember that your aunts live in Brooklyn. If you call 911, will the ambulance drive from Queens to Brooklyn? You doubt it. You continue to weigh your options, dreading the feeling of being criticized, uncomfortable, unsafe, and unable to relate with anyone about your beliefs, or even be allowed to incorporate non-therapeutic alternatives to promote your health. Several minutes later, a decision has been made. You now pull back the covers, praying and hoping for a miracle to come. I also wrote a short poem, and it's titled, Colors. Red, white, blue, orange, green, black. They're not whack, and that's a fact. Why do we hate when it is not our faith? Don't we all crave love and equality? Better yet, we should all come together as one harmony. Colors are a mixture of diversity. Without one, we are prone to disparity. Red, white, blue, orange, green, black. They're not whack, and that's a fact. Look around, what do you see? A friend, a mother, a father, a sister, a brother. Yet some are so blind to even acknowledge or even be bothered. Well, I say, colors are a mixture of diversity. Without one, we are prone to disparity. Thank you for your attendance.
I'm very proud to present the NU 201 students. As nurses, we are a large group of providers who have a central ethic of caring and an agenda of early intervention and health promotion to improve the health status of communities. We play an integral role in hospital and community settings to assist victims of domestic violence and sexual abuse. The NU 201 students have identified these two key social problems to help raise awareness.
Good afternoon. My name is Eugene Iginti, 201 student.
Hello, my name is Keisha Alston.
My name is Teresa Boone Smith.
Felipe Ferreira.
My name is Shamima.
My name is Zula.
My name is Abina. Kareen Robinson.
My name is Davika Matukna.
Our topic today is domestic violence and sexual assault. And as you know, in the Immortal Life of Henrietta Lacks that we all read, the Immortal Life of Henrietta Lacks doesn't just talk about the painful life of the Lacks family, but it also addresses new issues and current issues that's like domestic violence and sexual assault. And the United States Department of Justice defined domestic violence as a pattern of abusive behavior. I'm focusing on pattern because I'm going to come back on this. A pattern of abusive behavior in any relationship that is used by one partner to gain or maintain power and control over another intimate partner. And the New York State Coalition Against Sexual Assault defines sexual assault as activities involving power. Again, that word power. Differential, coercion, threat, and/or outright force. And I was saying that I was going to come to the word pattern. My brother yesterday, when he saw my work, he asked me, he said, Eugenie, what do you mean, what do they mean by pattern? Does it mean that my girlfriend can hate me and throw me out of my house? And I said nothing because it's one time. What do we teach kindergarten about pattern? We say, okay, black, white, blue, black, white, blue, a repetitive color, right? That's what we tell them, like a repeated action. But should we wait until they get to the stage that, I'm just going to take an example. I see Professor Kupeli that I know on the street, or Professor Rome, that she's been covered by bruises. She's been abused, and maybe I knew it. And I didn't do anything because I was waiting for it to be a repeated action. Should we wait until they get to that stage? You can see those, all of them, they're being abused and sexually assaulted. Should we wait until they die, just like the lady and the baby? Because it will get to that stage if we do anything about that. So we are here today to tell you, no, we shouldn't wait. We have to do something as students. We fought against secondhand smoking, right, on this campus. Now, if you're a smoker, you have to go outside and smoke. We protected against secondhand smoking. So the same way we stood for that, we have to stand against domestic violence and sexual assault. We have to end that cycle, as Professor Rom said. And in order to do so, I'm just going to take a little example. Usually, what do we as society, we do? I saw on TV, I'm going to use the exact word that I saw after a girl has been sexually assaulted. I saw on TV, it's in Yonkers, Channel 12. And I saw somebody, he was like, oh, anyway, she always shows her boobs. That's the word he used. Just to say she always dresses sexy, so she deserves it. Or she's always drunk, so she demands for it. No. Remember, sexual assault or domestic violence is never invited. And anyone here could be a victim. And we must stand up all together and fight against it. We must end that cycle. And in order to do so, we have to understand and better grab the concepts. And we have provided few individuals in the book, the Immortal Life of Henrietta Likes, who have been victimized. And before we give you the signs for you to understand when is somebody being victim of domestic violence, when is somebody is sexually assaulted, what is that? We have provided victim here, and they're going to tell to you about that before we give you the signs, the statistic, and all others. Thank you. Henrietta.
You don't know me, but I've probably changed the lives of everyone in this room. I'm Henrietta Lacks, and my cells called HeLa are the world's first immortal human cells that were taken from inside me and bought, sold, packaged, and shipped by the trillions to laboratories around the world. But you don't know me. I was born in Virginia, August 1st, 1920, one of 10 siblings. I've known my husband Day since I was 4 and he was 9. We slept in the same bedroom with all the other siblings and cousins. So no one was surprised when we had our first son, Lawrence, just months after my 14th birthday. Then his sister, Lucille Elsie, 4 years later. That's just the way things were done. I guess after 2 kids, we should get married. But Sister Gladys was against me marrying Day. She always insisted Day would be a no-good husband. but we did at our preacher's house on April 10th, 1941. There was no honeymoon because there was no money for no honeymoon. But we had a good life together. But I knew something was wrong. I didn't like sexual intercourse much, but I loved my 5 babies. But I knew something was wrong when the sex started hurting. I thought it had to do with baby Deborah, but I'd just given birth to her a few weeks earlier. Or it had to do with the bad blood my husband sometimes brought home after nights out with other women. You know, the kind doctors treated with penicillin and heavy metals? But it turned out to be something more, much more.
My name is Deborah, Dale for short, and Henrietta, that's my mama. My mama died when I was young, and I don't have many memories of her, except this Bible here. I keep it close. Boy, I wonder if things been different if my mama been around. My mama was always there. I done been through a whole bunch of mess in my life you wouldn't even believe. When I was young, me and my sisters and my brothers, we stayed with Ethel. Ethel used to beat us bloody, but if it was good, we get a piece of bologna. But that was every once in a while. When I was 10, the one man I felt most comfortable to, more than my own daddy, he used to beat and molest me. One time he hit me so hard and he punched me in the car, my eyebrow split open. I was bleeding. Other times, he used to force his hand up my skirt in between my legs. He would say to me, "Oh, you ain't got to worry about getting pregnant. I'll wear a rubber." Even though I was young, I knew it wasn't right. When he wasn't beating me, he was giving me gifts and loving me. You see, that's how it goes. That's how the cycle goes. They hit you, they love you, they give you gifts. I knew it wasn't right. Well, even though I went through all that bad blood when I was younger, even down in my life, when I got married to my husband, we went through so much animosity in my house, I tried to kill him one time. Lord, this took so much toll on my mind and my body. I done been through so much mess in my life.
How y'all doing? My name is Zachariah Abdul Bari Rama. I was born as Joe Lax. I was the last son, I was the last child of Henrietta Lax, born just before she was diagnosed with cancer. My story is about neglect, abuse, and violence. It all started when my mama left, and we got left with Ethel, and all she did is beat us, abuse us, underfeed us, and overwork us. She would starve us, only give us one meal a day, have us working all day in the plantation, and with nothing to eat. And if we did anything wrong, she would beat us and punish us all the time. But I believe she hated me the most, because even for not doing anything wrong, she would just abuse me. I would wake up getting pummeled in the face for no reason, or beat with a chair if I'm just sitting waiting for my dinner, which wasn't much. As punishment, she would lock me in the basement with my face straight onto the wall, and I had to keep one leg up. If she caught me with one leg down at any time resting, she would beat me with a stick until I was bloody. This was my childhood, and this is how I grew up. This is what made me the man I am, an angry, violent, very hateful person, which carried through my teenage years and my adolescent years and later on to early adulthood. I got into so many fights and so much trouble through my life that people started calling me Crazy Joe. This got me kicked out of school, got me discharged from the military, and later, soon after, got me into prison for murder, just because somebody started a fight with me. While I was in jail, I spent most of my time in the hole, simply because all I was doing was fighting, but the hole was a place I felt comfortable in, because that's where I spent most of my life in. But while I'm spending my time in jail, I also did find some peace with myself as I started reading the Quran and found Islam and was able to make some peace with everything. But I still live very angry today, and I always will.
My name is Ethel. Zachariah calls me an abusive, crazy woman? After all I did for him, his siblings, it was difficult to deal with these kids who were not good. Every morning I fed them each a cold biscuit that had to last them until dinner. I had to put latches and bolts on my refrigerator cupboard doors to keep them out between meals because they pretended to be always hungry. I taught them how to work hard. I woke them at dawn to clean the house, cook, shop, to do laundry. I taught them how to pick up worms from the tobacco leaves. Even though tobacco juice stained their hands and made them sick, when it got their mouth, I don't care. I taught them to walk sun up to the sundown without bricks and food or water until midnight. Even summer heat burned. I had to watch them from the couch or window. And no one of them stopped walking before I told to. I would beat them all bloody with my extension cord. The worst of Henrietta's children was Zachariah or Joe. I hate him and his mother too. I am jealous of Henrietta because everybody loved her. And my own husband, Garling, was liking him more than he liked me. Oh Lord, he followed her everywhere. She's his cousin. And try to stay at his home when husband is gone. It made me so jealous, made me hateful to Henrietta, something fierce here, right here. So after that, her dad, I moved to her home as a caregiver to take her place. It was my time to take a revenge on Henrietta's children because they couldn't do anything against me. Also, their father allowed me to do so. Then I was releasing my angriness and hatefulness to everybody. It made me powerful. I felt in control of everything. That's my excuse.
There are 4 phases of abuse. Abuse starts out with the tension-building phase, followed by the incident or acting out phase, the honeymoon phase or reconciliation phase, followed by a period of calm before the cycle of abuse begins again. In the tension-building phase, the abuser starts to get angry at little things, not having food on the table, or not being able to pay the bills. Communication in the relationship breaks down. Then we have the incident phase. The incident phase is where the actual abuse occurs. We have physical abuse is when the abuser physically harms the victim, giving her like scars, hitting, punching, pushing, slapping. Victims tend to miss work, school, or social occasion without any explanation. Victims have frequent injuries with the excuse of accidents. Then we have sexual abuse, where the abuser have intercourse with the victim without the consent to gain control. We have emotional abuse, which includes yelling, name calling, blaming, putting the victim down. You may think that physical abuse is far worse than emotional abuse, because physical abuse you can see the scars, and emotional abuse you cannot see the scar. But the scar of emotional abuse are very real, and run very deep. In fact, emotional abuse can be just as damaging as physical abuse. I think sometimes even more, because emotional abuse gives rise to psychological abuse, in which the victims tend to have low self-esteem, become withdrawn from activity, depressed, or even suicidal. The abuser uses power and control to isolate the victim. The abuser will use threat, intimidation, children, and economic abuse to force partners to stay with them. In the honeymoon phase, the abuser will apologize and beg for forgiveness and will promise that this will never happen again. The abuser will blame the victim for provoking and making this incident happen. The abuser will also deny or claim that the abuse was not as bad as what the victim claimed it was. Then we have the calm phase. In the calm phase, abuser acts like nothing happened. Abuser will give gifts. Victim will believe the abuser is over. The abuse is over and the abuser will have changed. But the cycle repeats with tension building phase again, with an increase in intensity with the incident phase. Here are some questions that if you know someone is being abused, that you can ask. If they feel afraid of their partner at times, do they believe that they deserve to be hurt or mistreated? If they feel they can't do anything right for their partner, or if they feel that they're crazy, emotionally numb, or helpless. Or you can ask them if their partner humiliate or yell at them, criticize them or put them down, ignore or put down their opinion, blame them for the abusive behavior, or see them as like objects, sex objects, rather than a person. Like one of my colleagues said in our introduction, it's really important, like if you see someone, to go up to them and ask them, give them the information, because at the end of the day, you can save a life.
Every 2.5 minutes, somewhere in America, someone is sexually assaulted.
One in 6 American women are victims of sexual assault.
And 1 in 33 are men.
About 44% of rape victims are under the age of 18.
And 80 are under the age of 30.
Victims of sexual assault are 3 times more likely to suffer from depression.
6 times more likely to suffer from post-traumatic stress disorder. 59% of sexual assaults go unreported.
Males are least likely to report, making up 10% of reported data.
Since 1993, sexual assaults have been cut in half based on reported data. But more than half were unreported.
Sexual assault victims are 13 times more likely to abuse alcohol.
26 times more likely to abuse drugs.
And 4 times more likely to contemplate suicide.
Almost 2/3 of sexual assaults are perpetrated by someone known to the victim.
And half that is a friend or acquaintance.
While images can make us aware of some of the emotions and consequences of sexual assault every 2.5 minutes, it's our action that will stop the abuse.
Domestic violence and sexual assault can happen to anyone, regardless of sex, age, gender, sexual orientation, social economic status. According to the New York State Data Bureau, domestic violence and sexual assault have been increasing over the years. 1 in 4 persons will experience domestic violence or sexual assault during his or her lifetime. Every 2.5 minutes, as stated in the video, someone in New York becomes a victim of domestic violence or sexual assault. Approximately 2/3 of domestic violence or sexual assault are committed by someone known, the victim knows, as stated in the video. Domestic violence and sexual assault destroys relationships and families. It passes from generation to generation, as read in Henrietta, in the Immortal Life of Henrietta Lacks. Henrietta, Deborah, and Zachariah all experience either sexual assault or domestic violence. It doesn't have to be that way. Even with the increased penalties, changes to custody laws and increased awareness through community efforts, domestic violence and sexual assault remains a pressing issue because most domestic violence or sexual assault are never reported. Help change this fact. Speak up, stand out, make a difference for victims of domestic violence and sexual assault. Give victims the support they need, they deserve. Could the people with the bracelets please stand up? You would represent the 1 in 4 persons that would be abused if the auditorium was full. Yeah. Thank you.
You can sit down now. Thank you.
Hi, I have a story about a lady by the name of Linda. She met her boyfriend when she was 18 and he was 31. He was one of her bosses at her workplace. They spent some lovely times together. She thought she had a wonderful man. But after 2.5 months, she found out she was pregnant, and that's when it all started. He kept her home and fired her from her work. She said, the first time he hit me right across the face was because I said I was leaving him. The hitting became beating almost every day. Even though I was pregnant, he did not care. He said, if you were a good girl, I wouldn't have to discipline you so much. She went on to say, I remember one day that I told him I hated him with every bone in my body. He hit me so hard I went flying across the bed and onto the floor. The days went by and I would get hit because I didn't vacuum before I dust. The house was not clean enough or there was a fork in the sink. I would get slapped again and again. He made excuses to hit me. The black eyes and busted lips and bloody body was all I knew. Thank you.
Hi, good afternoon. My name is Davika, and I'm also going to add on to what Kareen said. So I'm going to tell you a story about a young lady named Mary who was sexually abused at a very young age. Her first encounter was at the age of 4. One of her uncles would tickle her until she was out of breath, which seemed innocent enough. But that was just a distraction he used so that he could put his finger inside of her and just very nonchalantly would say, oops. At the age of 11, that's when she encountered her second experience of sexual abuse. Mary casually went by the neighbors to play with a friend by the name of Sheila, like children very innocently do. The neighbor, who we'll call Frank, sent his daughter Sheila into the kitchen. That was Frank's chance to touch Mary's breast. Mary felt like something was wrong, so she told her mom. And Mary's mother's response was, "Oh, now, Mary, Frank wouldn't do a thing like that." I just want to read a little excerpt from Mary's story, because it's very detailed. When I was around 12, Frank's nephew, Philip, came home from the service. Somehow, Philip found out that I was home alone. I woke up late at night to find Philip on top of me, his hands over my mouth, his penis inside of me. I was being raped. I can still remember the sound his belt buckle made. His only words, "And you better not tell your parents." The rape resulted in pregnancy. Early in the pregnancy, I miscarried in the toilet. I didn't even know I was pregnant. I didn't learn until later in life what had came out of me was a baby. It never occurred to me to tell my mom about Philip raping me. I gave up on her being there for me that day in the kitchen when I was 11. Later on, when Mary became a teen, she was seen as bad, but she was really just scared, sad, depressed, and she needed someone to talk to. All she wanted was someone to listen to her and believe her. She lost all faith in her mom. So sometimes all you need is someone just to listen to you to get your story out. Thank you.
Now, we're going to put on a little skit, but I just want to let everybody know that it may only be a few people in the audience, but we have to stand up because it means something. Regardless of the fact it may be one person or 5 people, you can make that impact. That's why we did it. Not just to get you out of your seat, but to really feel the impact. Now we have a skit.
Seriously, what is this?
What? That's your dinner.
Are you serious?
Yeah, made it for you.
I went to work this morning at 5 o'clock and come home and this is what you're giving me?
This is what I made. I thought you liked it.
I work 6 days a week while you sit here at home. What do you do?
I had to do some reading.
You can't cook, you can't clean, you don't have a job. What is the point of you?
I don't know. You here help? Trying to?
What?
I cooked for
I
you.
mean, I get up at
This is
5
my food.
o'clock in the morning, you weren't even here. Where were you last night?
I was some friends.
Friends?
Yeah.
Yeah, I'm sure you got with your friends. Yeah, getting drunk and getting crazy with your friends, weren't you?
No, not at all.
I'm sure you tried to pick up some girls, didn't you?
No, I would never do that.
Oh, really? Don't lie to me. Who are you speaking to?
Nobody. Just you.
Shut up!
Oh my God. Why are you hitting me?
I'm gonna go get me something to eat, because you can't pick anything up in this house. Daddy, why are you crying?
You hurt me. Mama hurt me.
Why mommy always hitting you? You don't have to take this, you know, Daddy.
I know. What can I do? I don't know where to go.
At school they told us domestic violence is not right. You can stand up for yourself. And look, I have the telephone number and information right here.
Okay, thank you.
Thank you. Thank you. Everyone is going to receive a flyer so you can have more information and numbers to call if anything needs to be if anything happens or referring to a friend. Thank you.